Did you know that cancer will affect 1 in 3 people at some point in their lives? Alarming as this statistic is, what's even more concerning is that millions of cancer cases are diagnosed too late every year, often because the early warning signs go unnoticed. According to the American Cancer Society, detecting cancer in its earliest stage, stage 1, can lead to survival rates exceeding 90% for many common types of cancer. In stark contrast, waiting until stage 4 often reduces the chance of survival to less than 20%. In the next few minutes, I'll outline 8 subtle warning signs that could genuinely save your life. These signs aren't the well-known symptoms you hear about. They're the understated signals your body may give well before the situation becomes critical. Tragically, most people ignore them, which can mean the difference between catching cancer early when treatments are most effective and facing a late-stage diagnosis. Now, you might be thinking, does every minor ache, pain, or rash mean cancer? It can feel that way after a quick internet search, but that's not what we're discussing here. These warning signs are supported by scientific evidence, not internet speculation. They've helped thousands of people identify cancer early and improve their chances of survival. Stick with me, because this isn't about creating fear. It's about empowering you with potentially life-saving knowledge. Here's what you need to know. 1. Persistent bone pain. One of the most overlooked warning signs of cancer is persistent bone pain. Unlike the temporary soreness that follows exercise or minor injuries, cancer-related bone pain intensifies over time and is often worse at night. When cancer begins in or spreads to the bones, it disrupts the structure of bone tissue, causing a deep, penetrating ache that becomes harder to ignore. For example, primary bone cancer, like osteosarcoma, often starts in the long bones of the arms or legs. Initially, the pain may resemble a sprain or muscle ache, but over time it becomes more severe and unresponsive to typical pain relievers. If you experience bone pain accompanied by swelling, tenderness, or unexplained fractures, consult a doctor immediately. Early detection is crucial for successful treatment. 2. Skin changes and rashes. Unusual skin changes can sometimes signal a more serious condition, such as leukemia, a cancer that affects blood-forming tissues. One hallmark symptom of leukemia is petechiae, which are tiny round spots on the skin caused by a lack of platelets. These spots, typically 1 to 2 millimeters in size, don't fade when pressed and may range in color from red to purple or brown. They often appear in clusters, particularly in areas under pressure, such as the ankles or beneath tight clothing. These rashes result from the body's inability to produce enough platelets, leading to blood vessel leakage. Unlike common rashes that fade or itch, these symptoms should prompt immediate medical attention, as early intervention can be life-saving. 3. Unexplained night sweats. Experiencing night sweats that soak your clothing and bedding can be more than just an uncomfortable night's sleep. While occasional sweating may be due to a warm environment, stress, or illness, persistent and drenching night sweats, especially when accompanied by fever and unexplained weight loss, can be a sign of lymphoma. These sweats are caused by the immune system's inflammatory response to cancer cells, which disrupts the body's temperature regulation. If you notice recurring episodes, consult a healthcare professional as soon as possible. 4. Sudden onset of jaundice. Jaundice, characterized by yellowing of the skin and eyes, occurs when bilirubin, a substance in bile, builds up in the body. While jaundice can result from various conditions, its sudden appearance in adults is a potential warning sign of pancreatic or liver cancer. Tumors in the pancreas can obstruct the bile duct, preventing bilirubin from being processed and leading to its accumulation in the bloodstream. Accompanying symptoms may include abdominal pain, dark urine, and pale stools. If you notice these changes, seek immediate medical advice to rule out or address serious underlying conditions. These are just the first few signs to watch for. Recognizing subtle but significant symptoms like these could save your life by allowing for earlier, more effective treatment. Fifth, fingernail changes. Subungal melanoma. Subungal melanoma is a rare but serious form of skin cancer that develops under the nails. It often begins as a subtle dark streak on the nail, medically referred to as melanonychia striata. While it may appear harmless at first, this vertical discoloration can be a critical warning sign that warrants close attention. This type of melanoma most frequently affects the thumb or big toe, although it can occur under any nail. Warning signs include a dark streak wider than 3 millimeters, streaks with uneven or multiple colors, blurred or irregular edges. Additionally, if the streak is accompanied by symptoms like nail splitting, bleeding, or pain, it's crucial to seek medical attention promptly. Subungal melanoma can be mistaken for a bruise or minor injury, so recognizing these features early could make all the difference. A biopsy is typically required to confirm the diagnosis, and early detection significantly improves outcomes. 6. Persistent fever, a potential sign of blood cancer. A recurring or unexplained fever can be your body's way of signaling a deeper issue, such as blood cancer. Unlike fevers caused by common infections, those related to cancers like leukemia or lymphoma often persist over weeks or return in a distinct cyclic pattern. These fevers occur because blood cancers disrupt normal immune function and stimulate the release of cytokines, chemical messengers in the immune system. Additional signs to watch for include fever that persists for more than 2 weeks without a clear cause, fevers accompanied by fatigue, weight loss, or night sweats. Blood cancers can weaken your immune defenses, leaving you more susceptible to infections. To diagnose the underlying cause, a physician may recommend blood tests to evaluate cell counts and identify abnormalities. Early detection of blood cancers is critical for improving survival rates and preventing complications. If you've been experiencing persistent fevers, it's essential to consult a healthcare provider for further evaluation. 7. Eye pain and vision changes. Ocular melanoma. Your eyes can offer crucial insights into your overall health, and persistent changes might signal something as serious as cancer. Ocular melanoma, the most common primary eye cancer in adults, often develops subtly but can escalate into noticeable symptoms that require immediate attention. Key signs of ocular melanoma include persistent blurred vision that doesn't improve with glasses, unexplained flashes of light, unrelated to migraines, a dark spot on the iris that grows or changes color over time. Ocular melanoma typically affects adults with lighter-colored eyes or fair skin and can result from prolonged sun exposure or genetic predisposition. Diagnostic tools like ophthalmoscopes allow doctors to examine the inner structures of the eye in detail. If you experience eye pain, sudden vision changes, or any of the symptoms listed above, schedule an eye exam as soon as possible. Early detection is essential to preserving both vision and overall health. 8. Persistent heartburn. Could it be more than acid reflux? Chronic heartburn or gastroesophageal reflux disease, GERD, may seem like a minor inconvenience, but if it persists despite lifestyle adjustments and medication, it could signal a more serious issue, such as esophageal cancer. The connection between chronic heartburn and cancer lies in the repeated exposure of the esophageal lining to stomach acid, which can lead to damage and increase the risk of malignancy. Warning signs to watch for include difficulty swallowing, dysphagia, a sensation of food getting stuck in your throat or chest, unexplained weight loss. If heartburn lasts longer than 3 weeks without relief from over-the-counter treatments, it's important to consult a healthcare professional for further evaluation. Endoscopic examinations and imaging tests can help identify abnormalities early. While heartburn doesn't always indicate cancer, persistent symptoms deserve proper medical investigation to rule out serious conditions. If you found this information helpful, please share it with others who could benefit and subscribe for more evidence-based health content. Early awareness and action can save lives.